Yeah, so for us, I think it goes back to, look, we need to continue to innovate and to do things better and better. What we're thinking is we should be able to deliver better services, cut the cost of delivering those services, and also speed. Every day that goes by without healthcare services being available, people are dying. So that's also an important factor we need to work towards. So which is why our conversation and partnership is developing with Cubic. Let me shift gears again. Dr. Yarai, are you still here? I haven't seen you in a while. There you are. Okay. Thanks for joining us. So Dr. Yarai is one of our first partners, and he's the CEO of Saglan WAJi Hospital. Really does amazing things through his non-profit arm as well. I'm not going to spend time introducing too much about what he does, but Abel mentioned earlier, our first electrification project that we were learning in the process as well was partnering with him to electrify his operating room, which even though his hospital is well supplied and exists on the outskirts of the capital city, Addis Ababa, brownouts and blackouts were actually causing a lot of problems. So he was forced to use diesel generators. So we switched those out. So Dr. Yarai, from the horse's mouth, if you can tell us what the solar solutions has meant, and if you have one or two lessons you want to share with our colleagues at the ministry, our colleagues across Africa and the rest of the world. And again, please be as brief as you can. Apologies.
Thank you. I'm Dr. Yarai Free. We are one of the first partners to have worked with Precise on their implementation. It was a very exciting experience, to say the least. For us, it was more of a mindset shift because as the private sector, we are not really the type of people that invests in the solar energy. There has been a huge mistrust in the solar energy because of our experiences that we see in the local market. Because of that, there has been a major shift on our side to view solar energy in a different way. Not only solar energy, but also electricity. We were never energy conscious. We never thought about checking the power supply when buying a radiant warmer. So that experience have made us very energy conscious. And we really see the difference when we are able to go from our hospital into other hospitals. So we conduct a lot of outreach outside our hospital into government hospitals in all parts of Ethiopia. And we have been so used and to being comfortable with not having any power disruption that the moment a power disruption happens, you'll be shocked. So I think that comfort needs to be able to be delivered in a lot of Ethiopian cities and in a lot of Ethiopian health centers. I'm not sure if I'm able to share a screen, but if I am, yeah, I think I can share a screen. Can everyone see my screen? I prepared small wisdom that I have taken from our experience in healthcare. So we really believe that solar energy is the back pillar of revolutionizing our healthcare and our health insurance system. We have a very weak health insurance system in Ethiopia, and we think power is really behind most of it. I'm going to keep it as quick as possible and describe and finalize my PPT. So in Ethiopia, we have the Ethiopian Health Insurance Agency, which is a government body that has more than 56 million members. The biggest challenge for the insurance agency is, although it has 56 million members, all of its members are collected at the lowest level, which is called the Warada level. This is a huge challenge. They want to digitize this step. Digitization, when we are talking about 56 million spread out to all Ethiopia, requires some form of electricity. So for the government to be able to digitize and enable this health insurance agency to become viable and work as efficient as possible needs electricity. So I think solar energy really plays a part in this. The second is the government hospitals and the government centers. Like Abel mentioned earlier, we can speak for hours in regards to the electricity challenge that people face. But our hospital has a strange experience. There's 30 kilometers away in another government hospital. So let alone energy, use of energy has also been a challenge. So we have had a story very near to our hospital where to an ICU patient, that means patients that are born prematurely, who are admitted to the neonatal ICU had passed away because the divider was not working. So our energy conscious level is not only availing it, but actually even properly using the electricity. So if people die because of a divider, you can imagine how many people die because of power outages. So I'm sure there are a lot of stories, horrific stories, some that we can't even speak here out loud, but there are a lot of horror stories that happen because of disruption of electricity. The third is the Ethiopian insurance scheme, where a lot of private insurance exists. It's more than a $500 million market, but all this is also not digitalized. So because of this, not everyone, including me, have health insurance in Ethiopia, private health insurance. Also here, the electricity is really the backbone of digitization. When power disrupts, when there is power disruption, you can't imagine how many services that are affected. So I also believe here, again, to provide proper private insurance, we need a stable type of electricity. Coming from the mindset of the private sector, I have changed my mindset and how we view insurance. After the installation of the Precise and Selco team at our hospital, we have started an expansion project. And each step that we do, we have been really energy conscious, and we have even installed some form of solar energy. Our warmers for water are now solar energy. Some of our service will probably solar energy. So the mindset is really changing. But one thing I would like to raise here is, as a private sector, we are personally ready to invest in solar energy, but access to finance is also limited. We are ready to take out loans to provide access to solar energy, but the banking sector here is not that well. So I think involving that sector will also be very crucial, especially coming from the private sector that has had a mindset shift, but still don't want to spend huge amount of capital investment initially when we compare it to diesel, where we have to spend gradually for fuel and diesel. So that is my wisdom take from my short experience. I have tried to keep it as short as possible, but you can reach out if you have any additional questions when it comes to private healthcare, insurance, solar energy, anytime. Thank you, Henok.
Thank you, Dr. Yarai, and it's always fantastic to see you. For the non-Amharic speakers, his name means the fruits of vision, Yarai Fre, and you can see how he operates as a private sector operator, not just fixed on profits, but really on making sustainable impact. So one of our favorite partners, one of our earliest partners. Thank you so much for being with us. We have a few minutes to take questions. Instead of me reading all the questions, I'm going to read one or two questions. But in the meantime, our panelists, please look through. I think you can see the questions. Address whichever question you want to address for a couple of minutes. What I could promise is we can take these questions and send to the panelists and come back to the audience with the answers to them if we don't address them now. I would still need a few minutes for His Excellency Engineer Hailu to say his final words. One question is from Alav Gabravaskal. Building on the emphasis on stakeholder engagement and ownership models, I would appreciate if the panelists could elaborate on the specific strategies used to incentivize and empower local communities to take ownership and ensure the sustainability of their electrified healthcare centers. Is one question. The second one by Gideon Ishatu is, what is the thinking of the government in addressing the challenges for planned health centers to be reconstructed or constructed? Let me just read those out, but if you see any question that